Blood in your spit. Don't panic, but don't ignore it. I saw a patient last week, call him Shankar, who spat out small amount of blood in the morning after brushing and gargling. It repeated on next 2 days. Shankar got scared naturally, went to the lung specialist, whom we call pulmonologist. Shankar had a chest x-ray done, which was normal, was reassured and sent. Shankar was not happy, and he went to gastroenterologist or stomach expert, thinking to himself, what if the blood is coming from his stomach? He was told by the doctor that if he spits out blood again, endoscopy will be done and look at his stomach. Just put on some tablets by the gastroenterologist and sent home. Shankar now was still worried because he used to have a bit of spitting of blood after gargling, even on the third day. Along with his wife, this time he went to his family doctor. Family doctor saw into his mouth with a simple torch and said he was bleeding from gums called gingivitis, inflammation of the gums, and referred him to the dentist. Moral of the story? Unless emergency, see your family doctor first. Blood in your spit, don't panic, but don't neglect. Watch this video till the end so that you don't miss certain points that could save the life of your loved ones. The bleeding continues, and if you are actually coughing up blood from your chest, or if it is accompanied by symptoms like fever, weight loss, breathing difficulty, chest pain, persistent cough, then it deserves medical attention. An elderly man, chronic smoker, repeatedly coughs up blood should never ignore it. Must meet the specialist then. The causes of the blood from mouth can range from infections, pneumonias and bronchitis to tuberculosis, other lung diseases and lung cancer. Remember, most lung bleeding is not due to cancer. If you vomit blood, on the other hand, say a half cup or more than that, it's a matter of grave concern. It could be from the stomach or from the duodenal ulcer or certain esophageal conditions like varices, which are small blebs ready to bleed any time. They normally occur in people who drink a lot of alcohol, or it can also occur in normal people without alcohol intake in a liver condition called MASLD, metabolic associated steatotic liver disease. Another important cause of blood from the mouth in recent times is blood thinning medications, which are used in some people by the super specialists. Now, here is a simple rule to remember. A small amount of blood in the spit once may be nothing. A small amount repeatedly is something. A large amount coming from the mouth is always something. Maybe coming from lungs, maybe airways or stomach. So if you notice blood in your spit, don't immediately assume the worst, but don't keep reassuring yourself indefinitely either. Pay attention to the pattern of this blood from your mouth. If it is persistent, recurrent, and associated with other symptoms, as we said above, get it checked. Meet the specialist or the super specialist then, or still better, the hospital in emergency bleeding situations. Because in medicine, early attention is usually far better than late regret. Don't forget to take photo of your blood spit. That one picture speaks 1,000 words to your doctor. Blood in your spit, don't panic, but don't ignore it either. Take care. Bye.